Okay, so next I'll be testing her C6 nerves. So that will just be down the arm all the way to index and thumb. And so I'm going to have my patient bend their elbows. And so I'm going to apply downward pressure and they're going to resist elbow flexion. C7, I will touch her middle finger right here and ask if she feels that. And then I will push up on her arms like this and have her resist extension, so push down on me. Good. And then for C8, it'll be pinky all the way up to close to the medial aspect of the elbow. And so to test for the motor function of that, I'm just going to have her touch her pinkies to her thumbs. Good. For thumb opposition. And T1 is just going to be the medial side of her elbow. And so asking the patient if they feel that at all. And to test for the motor function of that, I'm just going to test for resisted abduction of the fingers. So I'm going to have her index finger and the third phalange, and so I'm going to press in as my patient pushes out against me into abduction. And there seems to be no problems in that area. And then I can also just test for any vascular problems and make sure that there is cap refill in fingers and that there's no edema or ecchymosis anywhere to prove that there's been bruising going on. And another test you can do is the Mears impingement sign, just to rule out shoulder impingement, because that's a big sign for scapular dyskinesis. That could be a differential diagnosis. So what I'm going to do is I'm going to stabilize my patient's shoulder right here on the back, and then take her by the wrist and just pull down on the wrist a little bit, and then I will bring it up and ask her if there's any pain with that. And usually there will be pain if there is impingement between 90 degrees up to 180. Another test I can do specifically for scapular dyskinesis is the assisted scapular resistive test. So I'm going to apply one finger to the bottom of the scapula and one to about the side, and just have my patient go up into shoulder flexion. So just lift your arm up like this in front, good. And that should cause a little bit of pain along the scapular area. And then I'll have her bring it down. And I want you to do the same thing, but I'm going to help your scapula move. So just raise your arm again. And a positive for this test, good, you can drop it again. A positive for this would be a relief in symptoms while I'm assisting the scapula. And a final test that you can do just to help rule out some labral problems is O'Brien's test. So I'm just going to have my patient extend their arm and go into shoulder flexion, and then turn down like an empty can and bring your arm slightly across your body to about here. Good. And then I'll stabilize at the shoulder and just push down on her arm. And so that is usually recreates pain and symptoms. You're good. Recreates pain and symptoms with labral tears. So whenever you do that test, you can rule that out to prove that it is just a particular scapular dysfunction. And that is all for today.